My name's Jim Bemister, and I'm a respiratory therapist. And I just wanted to do a quick demo of how to do deep suctioning through the nose, or nasal suctioning. I have a suction catheter here. Try to keep the end of it sterile. You would apply the lubricant and then try to pick the nares that you think is the largest. And then I'll go straight in. Once you get past the first little bit, you want to kind of change the angle to get it to go straight down. You're trying to follow the roof of the mouth as opposed to pushing it up into the nares where it's tighter. So I follow it down, and as I'm going down, once you get it in about, sort of the length of your hand, about 6 inches or so, you're probably at the back near where the tongue is, and at that point you're trying to get into the airway. Watch the patient, and as they breathe, you're going to advance on inspiration and pause on expiration. So as this patient would breathe in, I would push it down, and then wait till he breathes in again, and then I would push it down. And what you'll find is, if you're getting it through the vocal cords and into the lung, when you push it down during inspiration, the patient will begin to cough. And at that point, what you want to do is advance it in as far as it will go. And then once I get it all the way in, then I'll apply the suction and start pulling back. And what you'll find is maybe it doesn't start to suck very much at the beginning, but you'll get to a spot where there's lots and lots of secretions, and I would leave it sitting there for the moment while there's lots of motion in the secretions, and when it stops moving, then I would continue to just slowly pull it out. And then when you get it to the point where it's full of secretions, then normally you would have a jar or a cup of solution to rinse this out, and then you could try that again. You wouldn't normally do this on someone who had a spontaneous cough that was able to bring stuff up, but people, sometimes if there's maybe someone with a spinal cord injury, or their level of consciousness is down, they're not able to cough and clear the secretions, but you can hear that they have them. They may not let you suction them orally deeply because of their gag reflex, but they will tolerate a lot of times a nasal suction. And you might try this once and see if there's a lot of secretions in there and if you're able to get it into the lung. If when you're doing it, you're finding there's a lot of resistance, try not to force the catheter down because you could cause a nosebleed, or when you bring the catheter out, if it has caused a nosebleed, you probably want to not continue doing it. If it's something that does work well as far as suctioning and clearing their secretions, and you want to do it repeatedly, then at that point I wouldn't necessarily just do this through the nares by itself. At that point I would probably put a nasopharyngeal airway in first, and then that would reduce the trauma of the catheter going down through the nose. And I have another video on how to insert the nasopharyngeal airway.